Why do some families experience worse health than others? The answer often lies in the social determinants of health, the social and economic conditions that interact to shape the health and development of individuals, families, and communities in the environments where they are born, grow, live, work, and age. This video will explore the story of a woman and the impact of three of these determinants on both her and her family's health. Sex assigned at birth and gender are social determinants of health that are experienced in Canada and globally. Women and gender minorities experience increased rates of domestic violence and decreased access to well-paying jobs. Both of these have a negative impact on health. After years of escalating abuse, Sarah finally leaves her partner. Up to one-third of women experience domestic and family violence. The majority of violence experienced by women in Canada is from a male intimate partner. Rates of this violence further increase when combined with other determinants of health. An average of 102 women and girls were victims of gender-related homicide each year in Canada between 2011 and 2021. 93% of these homicides were committed by a male partner or family member of the victim. Income can affect a family's ability to afford healthy food, stable housing, medications, childcare, and transportation to medical appointments. Despite being a high-income country, Canada has a long-standing history of poverty and large differences in income between families. Sarah left to protect herself, but she has nowhere to go. Her income is limited, and shelter spaces often have the same violence that she is fleeing from. Limited income can make it difficult to access safe housing, transportation, and basic needs. Without financial stability, leaving an abusive situation can also mean facing homelessness. Intimate partner violence often leads to homelessness for women, and nearly one-third of women in shelters for abuse victims say they were already homeless before arriving. Many people without stable housing avoid shelters out of fear of violence. Getting timely, high-quality healthcare helps prevent illness, catch problems early, and provide effective treatment, leading to better health for individuals and families. However, many people in Canada still face barriers to care, including long wait times, not enough healthcare providers, costs for services that aren't covered, where they live, and stigma. Sarah now knows that she is pregnant. She also knows she should get healthcare, but does not feel welcome in those spaces. She feels judged talking to doctors or nurses, first for not leaving an abusive relationship, and now for living on the streets. Stigma and discrimination are among the most significant barriers to accessing healthcare for women who have experienced domestic violence. Survivors of abuse often have had negative experiences with healthcare providers that lead to a lack of trust and feelings that they don't matter. These feelings are even stronger for those who are already marginalized, such as First Nations women, immigrants, or individuals experiencing homelessness. Understanding the complex situations and overlapping factors that lead to poor health for individuals and families helps us move from a place of judgment to a recognition of our shared humanity. For many, poor health is much more than just a choice.